In this video, let's talk about a chiropractor and what value a chiropractor may add to your care. The chiropractic profession has been around for over a century and has a long history of managing and taking care of patients in the United States and worldwide. I have worked with many chiropractors in my career and have had much success integrating and working with them and have a lot of appreciation for the work that they do. There are a few things that patients should understand as to why a chiropractor may be very helpful for them and why a neurosurgeon, such as myself, might recommend working with a chiropractor. Number one, the history and physical exam is the most important aspect of the diagnosis in medicine. We can figure out most medical pathologies with the history and physical exam, and that information directs testing in the most appropriate way. Chiropractors tend to spend a lot of time with their patients and really get to know them over time. They also do very good physical examinations, in part because they're manipulating the spine and other areas of the body and understand the patient's own physical exam in some ways better than anybody else. For that reason, I think that chiropractors can be very good at helping to diagnose problems that you are having. Another thing that I really like about the chiropractic profession, and it may seem somewhat counterintuitive, is in the United States, they cannot prescribe a medication and they cannot perform a surgery. Most of the providers that you might see in the spinal space, taking care of spine problems, are able to prescribe a medication and are able to perform a surgery. So why would that be an advantage? Well, the chiropractors are not programmed or motivated in the same way that, say, a surgeon like myself is. I am looking for patients that I can do surgery for and help with surgery. Other patients, I may not be as invested in their care, and in some ways, I have a hammer and everything becomes a nail. A chiropractor, on the other hand, is not necessarily motivated by performing a procedure for you and has a vested interest really in developing a long-term relationship with you. A final thing that I think should be considered is that a chiropractor can become a very powerful advocate and ally in your care. They can reach out to providers and help to coordinate care. There's very little coordination of spinal care in the United States. It's very fragmented. People go to an office, they are seen, it's a quick visit, a diagnosis is made, and a treatment is prescribed. We need more management of spinal care, and I think a good chiropractor is a wonderful resource for you to develop a relationship with and to have help manage your particular case.